I oversee the operations of the cardiology services. Due to our increasing patient population for pediatric cardiology, in October of this past year, we moved from the PI D side and moved to our new unit, which has 10 beds. So with the 2 additional beds and a dedicated staff with the experience in taking care of cardiology patients, it provided the best environment or services for those patients. In addition, we've hired new staff who have gone through an intense orientation and education program to learn how to take care of CICU patients. Construction is underway for the new South Tower, where the Heart Center will have 1.5 floors. One floor will house a 14-bed CICU, 2 CVOR suites, 2 cardiac cath labs, and a 7-bed pre-op, post-op area specifically for our Heart Center patients. Over this past year, we've worked really closely with the NICU. The nurses that specifically take care of the cardiac patients have worked with our cardiac ICU nurses to cross-train and learn about the CICU. I think there's been a great sense of collaboration between the 2 units to help improve the care that's provided to those patients. The need for the adult congenital heart disease program was recognized because 20 to 25 years ago, children who were born with congenital heart disease did not have favorable outcomes, but due to advances in diagnostics and imaging and surgical interventions, those children or infants now live long, healthy lives. So it's a little bit of a newer patient population. So we recognized that need and wanted to provide that full service to our patients as they transition into adulthood. We have been working diligently to provide training. We're transitioning them to, a better level of care that's going to be more suitable as that child has grown into adulthood. We will be adding a fetal nurse coordinator to our program, which is something that's really exciting for the coming year for the Heart Center. What this nurse will do is work with moms who have been referred to the Heart Center. So the nurse will coordinate and be that resource for the mother to work with, and will be instrumental in helping the mother understand what to expect through the remainder of her pregnancy leading up to the birth of that infant, and then what to expect immediately after birth and the transfer of that infant to Cook Children's, particularly when these moms present from outlying areas, not just within our immediate service area. There is a tremendous amount of teamwork and collaboration amongst the Heart Center staff. There's a sense of pride and care that we provide to our Heart Center patients, which makes it a fantastic department to work for.